Harold Frederick Shipman was born on the Bestwood Council estate in Nottingham, England, on January 14, 1946. He was the second of just three children. Harold was the son of working-class parents who were devout Methodists. They took education very seriously. In school, he also excelled as a rugby player and distance runner. During his final year at school, he served as vice captain of the athletics team. Shipman was particularly close to his mother, who died of lung cancer when he was 17. His mother gave him a sense of superiority, which was tainted, leaving him isolated and with few friends throughout his adolescence. However, Shipman always found the medical profession interesting. Unlike many other notorious serial killers, there is little known about Shipman's childhood behavior and how it influenced him as a serial killer.
On November 5, 1966, Shipman married Rose May Oxtoby. Together they had 4 children, 3 sons, Christopher, David, and Sam, while having a daughter named Sarah. Following their marriage, Shipman studied at the Leeds School of Medicine, where he graduated in 1970. Early in his career as a general practitioner, he was caught forging prescriptions of Demerol for his own use. For this offense, Shipman was fined and forced to attend a drug rehabilitation clinic. Later, Shipman worked on the staff at Donnybrook Medical Center in Hyde, where he was thought fondly of by many of his patients and colleagues. However, the local undertaker noticed that Dr. Shipman's patients seemed to be dying at an unusually high rate, and most had similar causes of death. He was concerned enough to approach Shipman about this directly, who reassured him that there was nothing to worry about. Later, another medical colleague, Dr. Susan Booth, also found the similarity disturbing, and she alerted the coroner's office, who then contacted the local police authorities. Throughout his time at Donnybrook, it was suspected that Shipman killed somewhere between 215 to 265 of his patients.
Most of his victims were elderly patients, although some were terminally ill. Almost all of Shipman's crimes took place at the home of his elderly victims, where, while under his care, he would inject them with lethal doses of drugs, mainly morphine. Shipman's victims were usually found fully clothed and sitting in the upright position. Things began to greatly unravel for Shipman following the murder of 81-year-old Mrs. Grundy. For this crime, Shipman forged Mrs. Grundy's will so that her estate would be handed to him following her death. Indeed, his killing spree was only brought to an end thanks to the determination of Angela Woodruff, a lawyer and the daughter of Mrs. Grundy, who refused to accept the explanation for her mother's death and will. Some analysts of Shipman believe that he wanted to get caught at the time of this crime. After all, the forgery was sloppy. Shipman's fingerprints were left on the will. Others believe that Shipman may have lost touch with reality, beginning to feel as though he were invincible after all of the crimes he had gotten away with. In order to get away with the crimes, Shipman would use his status to alter the medical notes directly after the killing to ensure that his account matched the historical records. What Shipman had failed to recognize was that each altercation of the records would be time-stamped by the computer, enabling police to know exactly which records were altered.
Throughout the trial process, Shipman changed his story multiple times and was caught in numerous lies. He had an arrogant demeanor throughout the trial, doing little to none to assist his defense in painting the picture of a dedicated health professional. Harold Shipman was tried and convicted of 15 individual counts of murder, as well as 1 count of forgery in the year 2000. The prosecution asserted that Shipman had killed the 15 patients because he enjoyed exercising the control over life and death. He dismissed any claims that he had been acting compassionately, as not all of his victims were suffering a terminal illness. The government paleontologist led the court through the gruesome post-mortem findings where morphine was the cause of death in most instances. Thereafter, fingerprint analysis of the forged will showed that Kathleen Grundy had never handled the will, and that her signature was dismissed by a handwriting expert as forgery. A police computer analysis then testified how Shipman had altered the computer records to create symptoms that his dead patients never even had, and in most cases, within hours of their deaths. Shipman was found dead in his cell in Wakefield Prison on January 13, 2004, having hanged himself. It was the eve of his 58th birthday. Harold Shipman is known as Britain's most prolific serial killer, widely known today as Dr. Death. He killed countless of his patients with little to no remorse. It is known that Shipman was using deadly doses of painkillers and other drugs to kill his patients in a rapid fashion. His ability to use his medical status to manipulate and kill innocent patients serves as a reminder that a serial killer can be just about anyone.